Hello, my name is Dr. Terry Oler. I'm a podiatrist at Totally Feet Podiatry and Laser Center in Westminster, Colorado. Today I'm here for My Foot Supply. We're going to be discussing orthotics. There are three major types of orthotics. There are custom functional orthotics, which are the orthotics you get from your podiatrist. Even some pedi-orthotists and chiropractors are also making these devices. These devices are taken from a mold of your foot and then prescribed and sent out to a lab in order to have a custom impression of your foot translated into an orthotic that realigns the structure of your foot. Accommodative orthotics are a little bit different type of an orthotic. These types of orthotics are generally used to minimize or limit pressure in certain areas on the bottom surface of the foot. These orthotics come in a multitude of layers and styles as well. And the last one we're going to focus on today are the prefabricated orthotics. Now, many different manufacturers are developing prefabricated orthotics, and they come in a wide array of shapes, sizes, colors, and materials. The most important factor usually is the material and the style of these prefabricated orthotics. The major types that we're going to cover are the soft foam orthotics, cork orthotics, and the hard plastic orthotics. Now, in the soft foam orthotic realm, there's quite a few different materials and densities in the foam that are used in order to create these devices. The general purpose of all of these devices is to try to realign the structure of the foot in order to help it function more effectively and efficiently. The prefabricated orthotics at myfootsupply.com have a nice gentle contour to the arch. This arch is able to realign the bones in the arch into a much more effective structure, so you're able to ambulate more comfortably and also minimize a lot of those problems that cause foot pain, including plantar fasciitis, tendon issues, and arthritic changes in the foot. These orthotics are extremely effective. However, there are some tips that I would recommend when you are using any orthotic, ours or others. First, always put your orthotic underneath the insole of your shoe. This gives a nice cushion on the top surface of the orthotic without losing any of the control, and it also gives the orthotic a nice stable structure to rest on so it can actually do its job by giving you the control that you need. Secondly, I would also recommend that you have a nice pair of shoes that you're able to wear these orthotics in. There are certain characteristics of a shoe that are important when you are wearing an orthotic. First, the heel counter needs to be somewhat rigid, meaning that the area on the backside of your heel has a nice grip around your heel. Secondly, I would evaluate the sole of the shoe. Shoes that have a sole that is easily compressed, if you were to put your one hand on one side of the shoe and the other hand on the rear of the shoe, the heel side of the shoe, and if you can compress that shoe very easily, that's usually a shoe that's not going to offer you much support. Lastly, I would take this shoe and try to twist it. If you're able to twist the shoe and the sole of the shoe is extremely mobile, I would not wear that pair of shoes. The last tip is breaking in your orthotics. Every pair of orthotics, for somebody that has never worn orthotics before, needs to be broken in. What I tell my patients is wear your orthotics for 1 hour the first day, 2 hours the second, 3 hours the third, and so on. By about a week, you're up to wearing your orthotics throughout the day, and this gives your foot a period of time to acclimate to the new structure of your foot. If you have any other questions, please check out our website, myfootsupply.com, and we hope that you enjoyed our tutorial on orthotics.